health scare with cancer, and I use cannabis oil to heal myself naturally. I'm not going to sit here and try and convince you people of what it did, because I can't explain it. I don't understand it. But Regina is the person to talk about epilepsy and why it works for that. She works with children that have schizencephaly, so you're going to hear her firsthand experience with cannabis and her patients. And I'm so happy you're here.
Me too. Thank you.
Tell us all about you.
Awesome. Well, I think I'm hooked up. Do I need this one on too?
I think you're.
Okay.
You want to just hold it, or what do you want to do?
Can I have? Is that good?
No.
That's not me. That's the PA for everyone else to hear. I'm only here.
Oh, you're only hearing me through the other one. Okay. All right, we got this now. Hey, you guys, thank you. I'm Regina Nelson. And Tricia, thank you so much for inviting me here today. I really do appreciate it. We have had some really incredible experiences. I'm going to tell you about one today with a little girl with schizencephaly. But I came about getting into medical cannabis about five and a half years ago. I had been a casual cannabis user most of my life, I guess most since I was a teenager, for stress relief and other things. And I don't think I really realized I was using it really medically because it was illegal and it was wrong. And I had a family and, you know, I didn't really think that was something my kids should be doing. But when I started working on my PhD at Union Institute and University, I was really very curious about medical marijuana. Was it medical? Who was the, you know, my studies are really in leadership. Who was really leading this? Kind of what was really going on? And I was also suffering some health issues of my own. I was having a lot of really bad gastric issues. And I moved from Texas to New Mexico during my second term in my PhD program, and about 2 weeks later nearly died. I needed a major bowel resection, and they took out about 6 feet of my small intestine. And I spent several weeks in the hospital. I was about 30 pounds less than I am right now when I got out of the hospital, and I'm still really thin, so you guys, I was really sick. And I became a medical marijuana patient in the state of New Mexico, and I hoped that the doctor that I would meet with would be able to tell me how to use this better, and they didn't really have any information. So I went to the dispensary once I got my card, and I asked them for help, and they didn't really have any information. So what I really came to find out along my journey is that it's really patient to patient. It's people talking to one another. It's a lot of times people meeting in a cancer center or at a hospital or through groups like this where they come to have an understanding that someone may be using this and they develop a curiosity. So what I do is I go around the country with my partner Mark Patterson. We run a nonprofit called the ECS Therapy Center. And ECS stands for endocannabinoid system. Can you guys hear me? I feel like I'm cutting in and out, sorry. But the endocannabinoid system is an internal receptor system that we have in our body. And so we've kind of jumped ahead of people knowing and putting it into our title. But we go around the country. In fact, I spent a lot of time in Europe this summer educating on the use of medical cannabis. We go meet with hospitals and clinics, but we primarily do patient education one-to-one. So we can really understand each person's particular situation, how they got there, how long they've been there, what their medications are, and really try to help them communicate well with their medical team. So what is the endocannabinoid system and why is it really important? Well, as science continues to develop in this, we're coming to find out that the endocannabinoid system is not just an endocrine system, like our thyroid and our pituitary and our adrenals, but it's a primary endocrine system, meaning it's over all of those things. So its primary purpose within the body is to create homeostasis or balance, and any kind of illness or injury is simply an imbalance within the body that needs to be repaired, and that's what the body does, is it tries to repair itself with that. And so we have CB1 receptors that are primarily in our central nervous system, and CB2 receptors, which are primarily in our immune system. And they all react the same or similar to what we call endocannabinoids, or cannabinoids our body makes, like anandamide, and one that I can't even pronounce the name, they call it 2AG. And I was just at a conference where they've actually discovered a third endocannabinoid that they haven't named yet. They're still trying to figure out what it does within the body. But the one thing that we know about these particular things is that none of us would be here without them, because it is actually a CB1 receptor issue, and it is the endogenous cannabinoid anandamide that are responsible for every embryo implanting itself in a mother's womb. So if you don't start out there, you don't become a human. So it's a very important system, and this is something we don't know a lot about. It was only discovered in 1988. Early 90s, we only began discovering these two endogenous cannabinoids. Now we know that there are a lot of what they're calling minor cannabinoids, and again, we may even have another endogenous cannabinoid. The system also responds very favorably to phytocannabinoids. So phytocannabinoids, phyto, are from the plants. And there's only one plant where you can get a really full spectrum of cannabinoids, and that's the cannabis plant, Cannabis sativa, or what we've come to call marijuana. Now, we can find some cannabinoids in some other plants, but they're usually very small amounts. They're not really, there's not enough there to really extract and get much value out of them. But for instance, chrysanthemums have both THC and CBD, which are some phytocannabinoids that we're going to talk about. And then we're also starting to see synthetic cannabinoids. Some of you may be aware of Marinol, which is a prescription drug that's Schedule 3 here in the United States, and it is a 100% THC synthetic cannabinoid. So you can, how this came about, or I guess this came about, and shortly thereafter we started seeing things like K2 and Spice on sale, and people smoking these things and having terrible reactions, causing brain damage, death, seizures. Well, those are synthetic cannabinoids. These were made in a college lab. And so college students took them. Now we are in this big fight all across, well, really the globe, trying to deal with that particular issue. But we also have a lot of pharmaceutical companies that are trying to synthesize CBD, CBG, and some of the others. But for the only natural way to get those, right now it's through the phytocannabinoids of the plant. So in 2011, again, I started this PhD program, and in early 2013, I began partnering with Mark Pedersen, and we started an organization called Cannabis Patient Network Institute in Colorado. And the ECS Therapy Center came afterwards because we began caregiving in Colorado with this company, and once you began processing the plant and medicine, suddenly you can't take it out of the state you're in. So we looked at expanding through ECS more nationally from an educational standpoint, but we still work in Colorado as caregivers, and we work with a number of families. In 2013, when this picture that I have showing here is of me and Mark at the Colorado State Fair, and we were the first medical cannabis organization, thank you, to, much better, to ever go and do an educational booth at the state fair. And at that same week that went on, Dr. Sanjay Gupta from CNN, he put out his first weed special on CNN, and they highlighted a little girl named Charlotte Figge, who was 5 years old, who had Dravet syndrome and had seizures, and they were talking about how CBD and a particular strain named after her, Charlotte's Web, had been quite helpful for her. Well, what that did is the first 3 days we were at the fair, we didn't see hardly anybody. That hit on Sunday night. Starting Monday, people came to the fair to talk to us. And their kids would be, in wheelchairs or having seizures. There were all sorts of different things going on. Over the course of time since then, I'm going to say Colorado has probably seen no less than at least 100,000 medical cannabis refugees from all over the world. And that's just a guesstimate because nobody's really keeping track of this. But there are a lot of people that move from their home states when they can't access the medicine. This was the case for a family, and this that shares their story now very publicly on Facebook. And you can go to the page Supernova, and you can learn a little bit more about Nova Lee. But this is Nova Lee Harris. And she has schizencephaly, but she was the very first patient that Mark and I ever helped. When he began making cannabis oil, he wanted to learn more about making it so he could begin to teach others. And I was really sick and he was really sick, so it was more our own desperate need in the beginning. But when all these people started coming, there just simply wasn't enough oil in the dispensaries. Most of them don't specialize in this. This is a medical product, and truthfully, medical dispensaries are still very recreationally minded. They're typically not run by people who have a medical background and experience. They more have experience on the side of the plant, which is good that you get good product. Oh, I don't know why we went out here on the projector, because I'm still up here. Do you guys know where I lost my slide?
I'll find out.
Anyway, when Novaly's family was in Austin, Texas, and she was not quite 3 years old in the June of 2013, when it was before the fair, actually, even that she had arrived. And Novaly was diagnosed about 4 months old when she started having her first seizures with schizencephaly. And I want to get this back up because I want to show you her brain scans. But she only had 24% of her brain. As you guys know, she had the cleft brain. I don't have to go into as much with you guys as I do a lot of audiences on this. But the thing was, by the time that they let, by June of 2013, two of the best neurologists in all of Texas wanted to try to remove half of Novaly's brain and cut the communication between both sides to see if she survived it, if she would slow down or stop having seizures. We've now heard of other children having similar type surgeries, and typically they either pass during surgery or shortly thereafter. We're not seeing very much success there, but that's what the medical outcome that I've talked to many people has been. There really isn't an answer, and this little girl was having 300 seizures, sometimes an hour. So her mom was given a very small amount of cannabis oil from someone she knew well in Texas, and she tried it. And it seemed to settle things down a little bit. So they packed up, literally, her mother's an artist, and Barbara left all of her artwork by their trash dumpster. They put Novaly stuff in their car. They packed very few clothes for themselves, and they drove to Colorado. And they contacted Mark along the way, and their story was so compelling to us, we couldn't help but help them. And within 10 days, she had dropped the number of seizures she was having from, again, sometimes 300 an hour, to where she was sometimes only having 1 or 2 a day, and much, much smaller seizures. And we found that pretty miraculous. I'm trying to remember where I met my story since he took my PowerPoint. Apologize, you guys. But what was really interesting is we started to see that, you know, the oil that we had when we began, it wasn't CBD rich like it'd been all over the Sanjay Gupta special. It was THC rich. And we didn't know how a little child would respond to this. And yet by starting her with very small doses, she seemed to respond really well. What we've come to notice now that we've gotten to know several other children with schizencephaly and many children with Dravet syndrome. Charlotte Figge had Dravet syndrome. It responds really well to CBD. But the kids with schizencephaly seem to respond extremely well with THC. This is, again, the psychoactive component of marijuana, and it kind of makes everybody go, oh, we're getting kids high. But I think if you would ask her parents, they've never really seen her high. She took very small doses. She titrated to a dose. What I find interesting is most of the kids that I'm seeing with schizencephaly, they're targeting to a little bit higher doses than most of the kids with other seizure disorders. And Novaly is taking almost a 1/4 gram a day, or about 250 milligrams of cannabis oil a day, which if I gave that to any of you right now, you would just either 1A, hallucinate, but you would eventually go to sleep. But this has been a kind of a titration over a period of time. But about a year, not quite a year into her cannabis therapy, all of a sudden she started spiking some really odd seizures, and some different things started happening. They took her to the hospital. For the first time in a year, which was like a miracle in her life already at this point. And they did some testing, and they ended up doing an MRI, and what they came to find out is she had developed a pituitary gland. When she was first given all of the scans that she had between 4 months and 3 years, it was always noted very clearly, she is missing her pituitary gland. She had no pituitary function in any blood work. She needed growth hormone, she needed thyroid medicine, all these things. She was on 18 different pharmaceuticals at the time. And all of a sudden she started to gain some function. And when they did that MRI, they saw a malformed but partially functioning pituitary gland. In the last year, it's become fully functioning. So she's now off of like 12 different medications that were simply because she didn't have pituitary function, and for side effects of those medications. Her seizure control has been about 99% other than these few little spikes. But since they've completed a round in the hospital following the second incident, because what was going on was her parents were oftentimes giving her pharmaceutical medications meant to compensate for different things. For instance, sodium or potassium. And all of a sudden they'd give her regular medicine and she'd go into this huge seizure. They'd rush her to the hospital and they'd find out it's because the medicine nearly killed her. All of a sudden she had function, so giving her the medicine became harmful. So they finally kept her in the hospital and monitored her very closely for several weeks, mainly to get an idea of how well it was functioning. This is when they came back and said it seems to be functioning 100% and removed a great deal of her pharmaceuticals. Since her release, I think last week she hit something like 86 days seizure-free. She's also says mama and no. And that came very quickly afterwards. She's now sitting up almost completely on her own. She's reaching for toys. Her eyesight, again, most with schizencephaly are legally blind. And she's now focusing enough she can grab her dad's beard and pull him close. She can play and pick up toys and play with them. And these were things that she couldn't do before, because between all those seizures and the anti-epileptic medicine, she was unresponsive in between seizures. So this whole family's life has changed significantly. Tricia and I connected around that particular family and started talking. I've talked to others now across the country, and we're starting to see some really miraculous things. So I was really hoping we were going to have these screens up here, because I have 2 brain scans of Novalee, and if we don't manage to get them back up, you guys can connect with me and we can see them on my laptop, I think. But when they did this brain scan about 10 months after she'd been in Colorado, not only is there this pituitary gland that hadn't existed before, but you can visibly see the increased brain mass. You can see how much fuller the tissue in her brain is. When you get down to the science of it and the endocannabinoid system, THC specifically, though we have demonized it, has the ability to help regenerate brain cells. We're starting to use it with Alzheimer's patients and other things like that as well, and starting to see some really miraculous things. But what I find really interesting after this 80 years of prohibition is our biggest fear has been, what's it going to do to our kids? What's it going to do to our kids? I'm starting to see kids at sometimes weeks of age, sometimes days for premature babies and other things. But now I'm starting to see them 2-3 years after cannabis therapy and look through their records. And some of these kids have been IQ tested and have been told they'll never have an IQ maybe above 30 or 40. We're getting them retested now. They're testing at 75, 80. Developmentally, they've changed. Their personality has changed. They've become much more cognitive about all the things going on around them. And I would say, as a mother, I think the biggest thing to me is the relief it provides the family. When Barbara told me 10 days after Novalee started cannabis therapy that it was the first time she had been able to sit and rock her and sing through the ABCs in full without her seizing, that hit me really hard, because I had 6 kids and I always rocked them. I always sang with them. I didn't realize how privileged I really had been, So again, I think there's a lot, to really learn about this. So what we do with the ECS Therapy Center nationally is we do one-on-one calls with families, with with patients, and we have discussions and we try to help them understand how to best use cannabis therapy. If they're in a medical state, we try to help them connect somewhere where they can get help that they need to get access that they need. In Colorado, we again also run Cannabis Patient Network Institute. And so we actually do provide oil to families there. We have about 18 children that we currently take care of within the state. All of them came with a terminal diagnosis of some type, either cancer, seizure disorder, in Nova's case, particularly schizencephaly. And all of them have exceeded their lifetime expectations. They've also exceeded all the developmental expectations that had been placed before them at that point. From things like fine motor skills, which again seems odd, but we have really good research that show cannabis use can improve fine motor skills. So there's a whole lot. It's very broad with this, and there's really a lot to know. I brought a couple books, and I'm going to have them in the back at the end. And one of them in particular, the ECS Therapy Companion Guide, kind of really goes a little more into dosing and these kind of things. And I'm going to be available throughout the rest of the conference. If any of you really want to sit down and have a conversation with me, we can do that as well, or we can schedule a time to talk after the conference. But what I really wanted to do is give you guys kind of a more broad overview, and I think some of you have really already been looking at this. So what I really wanted to do was just open up the floor to questions so that we can more direct it to what you actually are interested in learning right now. So anyone have a question that they want to ask about the use of medical cannabis with schizencephaly or seizure disorders?
I'm losing my voice, so I hope you can hear me.
That's okay.
What is it, do we know what it is specifically about THC that's thought to be so regenerative versus the other cannabinoids?
Well, THC is the only active cannabinoid. So here's the deal, and this is where I see a lot of people with the CBD go wrong. If you get the hemp CBD, these hemp oils that have no THC, that CBD is not going to help you at all. If your endocannabinoid system isn't actively working appropriately, CBD can't activate the receptors. THC does. It's the only active compound. And we make a compound called anandamide, as I mentioned earlier, that was responsible for reproduction, and it's also expressed in high amounts in breast milk. And that again comes neuroprotective. But we know THC has neuroprotective abilities to it and neurogenerative abilities. And when I first started this, scientists were telling us if you use THC, then your body wouldn't make enough of your endogenous cannabinoids, therefore you are harming yourself. But they found that to be untrue. The truth is if you use THC, you improve the function of your endogenous cannabinoid system. So there are a ton of research around THC that shows it's anti-inflammatory, it's antifungal, it's antibacterial, it's anti-epileptic, it's neurogenerative, it's neuroprotective, and it works at a cellular level. And really, truthfully, we haven't looked at this from a medical lens. We've been looking at it as an issue of substance abuse. So we're just now really starting to look at it on a medical level, and there are people in, I know Germany and Spain that are really looking at, how it's affecting signaling within the cells, and we're still learning a great deal. Yeah.
Are you saying that exclusively THC has the ability to have all of those different benefits?
No, some of the other cannabinoids have some of those same benefits, but they're not active cannabinoids. They're inactive cannabinoids. So if you take, I'll give you the example of Charlotte Figi with Charlotte's Web. When that first CNN special came out with Sanjay Gupta, Charlotte's Web was 15 to 1 CBD to THC. Meaning when you put it all together, it had 4 to 5% THC and the rest was all CBD. Well, that 4 to 5% THC, that little bit, that was enough to activate the system and the CBD worked really well. But what you weren't told during that special is that Charlotte's mom also gave her just plain straight out THC every time she had a seizure. And this is something I learned through families. And it's been the parents who've, I think, really helped me understand dosing so much better. Thank you. He's got me back up here. These are, you guys can see now, the difference in her brain scans. So this was when she was about about right before she started cannabis therapy. This was only 10 months after cannabis therapy began. So not only do you have the pituitary, you can see the difference in her brain. Significantly, right? You don't have to be a doctor to see that. And so the main thing is we don't have a lot of studies with people with this. We're looking at animal models. This is still, this is still a Schedule I drug in our country. So there's still, though NIDA, the National Institute for Drug Abuse, and the National Institutes of Health are funding studies, even in the United States for this, they're really doing it outside of the human trials still. And so one of the things that I've talked to Tricia about is we're starting to work with, our group is starting to bring together physicians, and we want to look at particular conditions in large case studies. And schizencephaly is one that I'm very, very interested in because this I never expected. And I don't know how you can't explain it. I went from Colorado to, I was in Illinois this year, in Peoria. And Carmen and her mom Erica aren't here. I was hoping they were going to come. But I had gone in to do grand rounds at a local hospital there. And I told Nobley's story. And then I brought Carmen up. Because I said, this is a little girl that's been in your hospital for 14 years. You put her in the hospital just last year to break all her bones because of growth hormones and her needing to grow. This is painful. What if this could happen to her? We don't know what we don't know. But apparently, THC has some regenerative properties. We do know this, but we didn't know it would regenerate a pituitary gland. We've never seen that before. We've never given this to children before. What really drives me to the particular issue of kids is really my own experience. I have twin sons who are now 23 years old, but they were 25-week preterm babies. And they were the youngest of 6. So I can remember very vividly one night sitting on my bed, pumping milk with an electric pump that the hospital had sent home, and my husband walking in and handing me a pipe and saying, you need to take a hit of this. You're out of your mind. And I was like, no, I can't do that. This would be bad. You've seen these babies, they're tiny. This could be horrible. And he was like, Regina, it's not going to hurt them. You need to calm down. You got 2 kids with chicken pox, 2 kids in the NICU, and 2 other kids who are just kids. Take a hit. Calm down. I did. And I calmed down. And then I started crying because I felt so guilty. But in that little bit of use in my breast milk, neither of my sons had a brain bleed. We beat the odds by a huge margin with twin boys born at 25 weeks, 23 years ago. I met many, many, many other families who've not had the success we do. We're starting to work more and more with children with cerebral palsy. The younger we see them, and I'm now again seeing people sometimes very early in the first few weeks, particularly when there's been birth trauma. And what drives me to that is a couple of recent studies that have come out of Spain. They did some studies with some baby piglets, and they took them and they mimicked hydroxemia, or what happens with premature babies when they suffocate, they quit breathing. And this happened to my twins sometimes 200 times a day. The more it happens, the more chances you get that you're going to have a brain bleed and you're going to have a cerebral palsy type issue. And so every week they come in and they do ultrasounds of the baby's brains. Well, they took these piglets and they mimicked this. And in the control pig, there was damage in all 8 sections of the brain. In the other pigs, they gave them what they called CBD oil in the study, but when I talked to the researchers, it was half THC and half CBD, meaning it was 1-to-1, equal amounts. It was Harlequin, a specific strain, and it was done by alcohol Everclear extraction, just like we do it in our kitchen. They gave some of the piglets 1 dose of CBD oil, and they gave some 3 every other day. And at the end of the 8th day, they sacrificed the pigs and looked at their brains. And every single piglet, including those that only got that 1 little bitty dose, 1 milligram per kilo, meaning they only got 2 to 3 milligrams because they weren't very big, 100% brain restoration. As a mother and as a grandmother, it's way too soon for me to get on my pulpit and preach it. But in the United States, when every baby's born, the gonorrhea medicine is put in their eyes. Their heels are pricked and tested for a few minor things, and they're given vitamin K. I think if every single child were given a very small dose of cannabis oil, we might potentially cut things like cerebral palsy by maybe 50 to 75%. These are the things I hear from researchers. So with that, I'll go back to questions and see if you guys have any more questions. No. Oops, I lost my thing here. All right, again, I have a few books here with me today, the ECS Therapy Companion Guide, and I have a book called Theorist at Large. It was over my first few years of my PhD program of me trying to figure out, was this real or was this not real, from a wide variety of angles. And then I also have another book that is, all of these are available on Amazon.com, on talking to your doctor or talking to a patient about medical cannabis. Because what I find is doctors and patients have the same questions, they just have different thought processes about them depending on which side you're sitting on. And you can always reach us. We do run a 501c3 nonprofit. We run solely on public support. We're not supported by anyone in the cannabis industry. And states yet don't support funding for education within their states, even though they're medicalized. So these are ways you can get a hold of me. And if you don't have any other questions, I got one back here.
Hey Regina, thanks for the topic. I had somebody ask me just a minute ago, and I know the answer. That's why we need to vote yes on Amendment 2 in the upcoming election this fall. But is medical marijuana allowed in Florida?
Oh, we were just talking about this. Florida has a medical marijuana program, but it's extremely restrictive. It's very difficult to get into. Even once you're approved by your doctor, I was told you still have to wait another 90 days before you can access treatment. There's very, very little product available here. That bill that passed here was really bad. And this is something that we've been seeing across the country. That news about Charlotte set off a whole ripple through the cannabis industry going, hey look, we've learned about something new and it's non-psychoactive. Well, it's not really non-psychoactive. It's less psychoactive. And it does mediate some of the THC effects, but it's still mildly psychoactive. And again, CBD has a lot of the same effects as THC or helps improve those. When you talk to scientists, it's not necessarily about is it THC or is it CBD or is it CBG or any of these other phytocannabinoids. It's about the entourage effect of them all together. And what I'm finding here in Florida is that their products are really restricted. They're primarily CBD, so patients aren't getting the type of responses that we're seeing in some other states. And we see that too when people order, and I give you guys a warning right now, don't order hemp oil online. Bluebird, Charlotte's Web, Haley's Hope, it's illegal for you to do that. Even if they say it's okay, and even if your state, like Georgia does, says you can send it there, you still break federal law. You still have a chance that Child Protective Services will come into your home. All of these things. And not all of these products are good. Dixie Elixirs, their owner has been all over HBO, MSNBC. 3 years ago, I was constantly getting calls from patients whose children were ending up in ERs because they were using a hemp out of China that had impurities that weren't being tested for in the market. So I see these kind of things, and I think the cannabis industry is like a microcosm of the greater society, and it just, the bad things stand out more, and what people do to make money stands out more, and Florida was really harmed by the CBD, I guess, thrill of, you know, something new there without really any education behind it. Good question. I don't know if that answered your question, but yeah, there is one here. Yes.
Are there any CBD products which you would recommend you can purchase?
Well, you can't purchase it from an out of state and send them to you. But if you were here, I don't know what's on the market here in Florida. Robert right here is a Florida activist and has worked really hard. He'd probably be your better benefit from that than I would be on actually how to access it here in Florida. But, yeah, please.
Earlier you mentioned the Stanley brothers who produced Charlotte's Web. It was originally, I believe you said,
15 to 1?
15 to 1. Well, now their website, CW Hemp, and they say they'll ship everywhere. So have they dropped that ratio down?
It's 88 to 1.
So it's under the...
And it's under the .03 federal, which is a random guideline that makes no sense. Hemp can be as high as 6% THC, so this .03 doesn't make any sense. You actually get better biofuel at 5%. You know, all these kind of things that don't really make sense. But they did, and it doesn't make sense to me how they can say they have the same product when it's not. The numbers aren't the same. And the deal is people don't respond the same. And again, when you really, if you sat down with Charlotte Figge like I did, in addition to that, she was taking THC. They didn't let them air that information. She provided it. This is how we get our media. So we started talking to other people, and this is again how I came to understand that a lot of parents were rescue dosing their kids with THC if they had seizures. So they would give them the Charlotte's Web 88 to 1, and they doing a little bit better, and then they have a little seizure, so they give them a THC-rich cannabis oil. And they get them out of the seizure, and they do pretty good for a little bit. And I'm like, well, how often are you rescue dosing them? And they're like, oh, twice a day, 3 times a day. Why don't you just give them the THC first and see if they won't have seizures? They were like, oh, okay. And they do that, no seizures. So the thing was, no one was talking about that but the moms on social media and other things. And it made sense. And since that, I know at least 100 families that their doctor won't even refill their Diastat because it's expired 2 years in a row, and now it's very expensive. And they're like, well, you don't seem to need it anymore. And they don't use it to rescue dose anymore. And as you guys know, Diastat can have really bad consequences. Other questions? Yeah.
Do you have much knowledge about this community in Canada?
You know, I have a little bit in Canada. Where are you in Canada? Yeah, I was in Nova Scotia last year with a scientific conference, and Canada's got some really interesting stuff going on. Because the nation's growing, it's the government growing now. They took away the dispensary model, so it actually has, I think they had pretty fair access, and then all of a sudden it went way down, and now I think it's trying to work itself back up. But it's a difficult program to get in, but I do think with a child you can. I don't know how many, on our website we have a list so you can hit the link and go to all the states that have medicalized in Canada, because Canada's huge, yeah. Yeah. Robert.
Yeah, I just wanted to ask one more thing about the hemp or CBD in general. I've heard from a bunch of different parents through my website, and it all revolves around seizures and autism, that when they gave basically an isolated CBD product, which is what most hemp CBD products are, it actually increased the stimulant in autism and could sometimes increase seizures.
I'm hearing that as well, but again,
so be careful.
Yeah. So again, it sounds crazy that I'm saying THC all the time, but I'll tell you how I came about this. GW Pharmaceuticals has a product out called Epidiolex that's in clinical trial around the country. In fact, I have children in Illinois that are enrolled in the Epidiolex trial there. And it is an extract. It is CBD. It's 100% CBD. There is no THC in it. So a lot of the industry guys, they wanted to follow that model. So they started extracting CBD from their plants, and then they would also extract the THC. And then they would give parents 2 bottles and go, make your own ratio. And the parents would go, huh? And they would try, you know, like if they were at one before 8 drops and then 1 drop of this, did that work, did that not? And almost every time they were really messed up and they'd come over to my house or wherever I met them and they'd sit down and I'd go, well, why don't we stop all that? Start with the THC and only start with 5 milligrams, this little bitty dose. Do that 3 or 4 times a day for the next couple days and then try the CBD again, because then you've activated the system, and the CBD, it stimulates the receptor system. So if the system's open, it should be more receptive to that stimulation. And 1 of 2 things would happen. One, with the THC, they all did better. And half of them, when they start the CBD, the parent would go, no more. I'm not giving them any more CBD. Why? I don't know. I mean, all sorts of different reasons and all sorts of different conditions. And again, this is something that has been repeated with schizencephaly to me multiple times. Every time I know a child with schizencephaly that's gotten a CBD, they've had major seizures and ended up in the hospital. And I can't explain that. We don't know why. And CBD should be, you know, you wouldn't think, but it is, you know. Did you have a question? No? Okay.
Agreeing.
I
Yeah.
have a question. So there's THC,
Mm-hmm.
there's CBD,
Mm-hmm. There's many others. CBG is another one that you're going to start hearing a lot more about. What's interesting, remember I mentioned earlier that you can find some of the cannabinoids in other plants? There's only one you can't find in any other plant, and that's CBG, cannabigerol. And to me, that makes me think that's got to be a really big part of that entourage effect and things going on there. And we're starting to see people extract CBG and people get huge responses with both pain and cancer with it. And there have been a lot of studies that do, because they're trying to figure out what these cannabinoids do. So they isolate them so they'll understand each one, but they know they work better together. And in things like cancer, we see things like THC, CBD, and CBG, and they all work, but they work at different rates. And then when you put them together, they all work much faster. So from that standpoint, we'll start to see a lot of these others. We're also going to see one that's called CDC, and it's a brain chemical. It helps with the brain as well. And I think we'll start to see extracts on that for Alzheimer's and some other things like that. And in this book, the ECS Therapy Companion Guide, it was really, when I got sick and I was a patient, I'm a book reader. Give me a book, I'll figure it out. I'll read it, and I can do this. There were no books. 5 years later, there were no books, so I wrote one. And I don't know how well I did with it, but it covers the endocannabinoid system in chapter 1, and it goes into the phytocannabinoids, and I do talk about 14 of them. And then I get into dosing and the alternative delivery methods, because again, obviously your kids aren't going to be smoking pot, right? You're going to want them on oils. And I say that yet, I'm now starting to see some parents vaporize their children because it really brings them immediately out of seizures. So while it sounds wrong, it works right, and it's healthy. Cannabis can't hurt you. It's non-toxic. If you have an overdose, you may get weirded out of your mind. You may have hallucinations, but you won't die. It will not shut off your respiratory. It will not shut off your heart. It can't kill you. Very different than most pharmaceuticals. And what I see repeatedly, and I think it's the reason we have so much pushback against medical marijuana, is that when people come to this, all of a sudden their pharmaceutical usage drops significantly. They've done studies that show 25% less opiate prescriptions are written in states that medicalize. They're not talking yet about how much less is on the black market, too. They're not talking about how much less our teenage kids are using illegal prescriptions. And actually, teenagers are using less cannabis because it's been demystified for them. So from a whole standpoint, after all my studies, I look at this like the Lorax. 80 years ago, for reasons that had to do with greed and economy and newspapers and chemical companies, we just got rid of this. We didn't know then what it did, but it was in 1/3 of all the US pharmaceuticals. There were only 27 on the market at that time. Doctors didn't know for a year after it was prohibited that they had actually prohibited cannabis sativa. They didn't know what marijuana was. They petitioned for it to come back. They were denied. They did a research study, showed it was super healthy by LaGuardia in the 1940s. Backed it up in 1970s. Now we're in 2016 and we're just starting to even get close to human trials. So this 80 years of prohibition, we don't know what we don't know. I really think that it's this thing that people were eating it and they were cooking with it. Their clothes came from it. They pulled a pair of Levi's out of where they built one of the New York bridges in the 1919 or something like that. And they were made of hemp, and they washed them and just hung them up because they didn't degrade in the dirt. Hemp lasts. You don't sell more clothes unless you're buying them with cotton. They don't last. So we're starting to see all of these kind of things kind of go on. And I think as a society, we just really have to look at it at a greater perspective. But it's slow going because we do have all this stigma. But what I really think is going to happen, given all these refugees I've seen, we've got another generation coming up where a lot of them will have been treated this way. Or their siblings will. And they really will make a change, I hope.
I do have a question.
Okay.
Do you know of any, is there any evidence of any interactions with utilizing cannabis with or THC?
Yep.
With any of the anti-seizure medications?
Yes. Only carbamazepine. She asked if there was an interaction with seizure medications. And with children, particularly, carbamazepine is an anti-epileptic, but it's particularly bad for your liver. Okay, so
All of them are.
all of them are, but this one, here's what happens with carbamazepine particularly. What it does is it dulls, it doesn't stop, but it dulls your CB1 receptor system. Now let's go to that. That takes care of your whole central nervous system. Well, we've seen kids who've come to this happened in Oregon at the Children's Hospital. A child came in who was taking CBD, a CBD rich, and I don't know what all percentages it was, but they said, you can't do that in the hospital, and they gave her carbamazepine and she died within like 3 hours because it just toxified her liver and it was bad. So I suggest to people that they wean off carbamazepine. But the truth is people have been using cannabis and prescriptions and not telling anybody for a long time. What we see is that they work better. It's the reason people don't need as much opiates. There are studies that say cannabis helps, codeine work 900 times better. Well, if you can take 900 times less codeine, you're way healthier. But it's the same thing with the anti-epileptics. We see people, we try. My biggest thing with this is, and I get it, moms want to wean those really fast because there's aggressive behavior sometimes. There's all these other things that can go along with it. And they get a little bit of seizure control. Maybe they start cannabis oil and 2 weeks later they're like, this is great. And they just start weaning. And I'm like, whoa, give them just a little bit. Get some healing, one at a time. Go talk to your doctor. Don't talk to me. I'm not a medical professional. Go talk to your doctor about weaning these things. And they do get into regimens, but I've had many of them, they want them off and they get them out as fast as they can. And so then they'll have some seizures and they'll come to me like, they're having seizures. I'm like, what have you done? And they're like, well, I weaned this and I weaned that and I weaned this. I'm like, you wean too many things too fast. Like, whoa, you gotta slow that down. And that's one of my greatest concerns with this is that communication with doctors and patients. More often than not, even in medicalized states, my patients and their parents aren't talking to their doctors about this. They're just doing it, and the doctor's going, wow, they're getting better. It's the carbamazepine. And they're like, no, it's really not. They're not giving it to them or whatever. So I'm trying to encourage people, these are conversations that you should be able to have with your doctor. It's really important around the pharmaceuticals.
Well, you can't in the state of Florida because they'll call DCF.
Well, and that's one of the things that that my focus is on for the future as well, because I see that happen now. My partner, I'm going to say this story here real quick. My partner has lived with a family in Colorado. The mother, Stacy, was behind Jack's Law. Her son, Jack, was basically kicked out of school for using medical cannabis. The nurse actually ripped a patch off of him, and she went nuts. And the first time the bill passed, they made it where schools could opt in. No, not even Jack's school, and the whole state opted in. So they went back this year, they made it mandatory. Well, unfortunately, Jack passed away in August. But when he passed away, the police came in and treated his caregiver there like he was the criminal, not the fact that the child died from an overdose of pharmaceuticals. So these things still go on all over because, again, we're not educating. None of the states educate the law enforcement. None of them educate CPS. None of them educate doctors, nurses, medical. So we can just kind of keep going. And so it's a really frustrating situation for most. But for those who have done it, most of them really have had some real miracles. Novalese was a miracle. I'm really glad I got to finally show you those slides. Thank you guys for everything today. I appreciate it. Thanks for having me.